Hey, this is Jerry.
This is Lillian.
And hey guys, this is Ben, and we're going to be going over geriatrics in this video. So here's just the things we're going to cover in this video. We're going to run over the changes in anatomy and physiology, as well as some of the diseases that may occur in those systems. We're going to be hitting special considerations, just things you need to be aware of when treating a geriatric patient, or should be aware of. We're going to hit GEMS Diamond, which is a assessment system used for assessing elderly patients. Then we're going to also talk about polypharmacy real quick, and then we're going to talk about medical and traumatic assessments and things involved with that. So here we go. Changes in the aging body.
Okay, the respiratory, as geriatric patients are more susceptible to respiratory illness because their immune systems are not as strong. The muscles of the airway and elasticity in the lungs decreases, which makes it harder for geriatric patients to expel air completely.
So the heart's less able to pump blood as you progress in age, and the heart has a chance to hypertrophy, which just means it becomes larger in size. And when that happens, the chest cavity is already a very tight space, and so when the heart becomes larger, it has less room to move around, which means it has less ability to pump blood. So here's another thing that can happen is it's called venous status. It's when the veins stop functioning properly and blood begins to pool in areas, which then leads to blood clots. Also, the blood vessels become stiff, which puts elderly patients at an increased risk for aneurysms.
Alright, so the nervous system, the brain decreases in weight and volume. Sensory nerves slow down. You start to lose your vision and hearing. You have decreased number of taste buds, and you have the increased ability to sense pain.
So dementia can be seen in some elderly patients. It's just the brain is stripped of its ability to function. For instance, it shortens the attention span, loss of cognitive functions, and it can decrease their ability to communicate. So right now, at this moment, dementia is uncurable. There is no treatment yet. And it is caused by many neurological diseases. Some signs and symptoms are memory loss, confusion, decreased ability to communicate, as we said earlier, decreased attention span, and unable to perform daily routines. So delirium presents much like dementia, except for it's generally reversible and it's caused by tumors, femurs, intoxication, withdrawal from sedatives, current medical conditions, or malnutrition. So here's just a side-by-side comparison. Dementia is a disease and there's no cure for it currently. All damage that is done is permanent. Delirium is often reversible and is often caused by underlying conditions. So even though they present similarly, they are not the same.
Alright, so neuropathy. The nerves tend to stop working when you get older. So it depends where and which muscle or which nerves. So muscle nerves, muscle weakness, cramps, spasms, loss of balance, loss of coordination. Sensory nerves, tingling, numbness, itching, pain, burning, freezing, hypersensitivity. Autonomic nerves, increased or decreased heart rate, increased or decreased blood pressure, and constipation.
Okay, so the gastrointestinal system, saliva and acid production tends to decrease. As you get older, you may start losing your teeth. Serious gastrointestinal issues include bowel obstruction, GI bleeding, and renal failure. Some serious issues could be GI bleeding, and signs and symptoms typically you would see dark tarry stool, vomiting blood, blood from rectum, blood in stool, or blood in the toilet. For a bowel obstruction, it's caused by tumors, scar tissue, twisting, or folding. Signs and symptoms could include vomiting, bloating, constipation if fully blocked, or diarrhea if partially blocked. Renal failure occurs when kidneys fail to filter waste from the blood. Signs and symptoms would include weakness, shortness of breath, and confusion.
So the renal system is what filters blood, and the kidneys become less able to filter that blood, and so it's just not a good thing to have it. And the bladder also becomes smaller so they may need to go to the bathroom more.
Alright, so the ludocrine system, the heart rate may decrease, weight may increase, and they have a cold intolerance.
The musculoskeletal system, bone mass decreases, bone density decreases, and joints become less flexible. You would typically see this in patients with arthritis. Decreased muscle mass and osteoporosis can further weaken the bones, which makes geriatric patients more susceptible to breaks and fractures if they were to fall.
So, as we said earlier, the nervous system becomes less able to fight infections, which puts them at a higher chance for infections. Also, the signs and symptoms may be milder. Since the nervous system is not as active, they may have a serious sickness, but the signs and symptoms don't present accordingly. So, just even though the signs and symptoms may not indicate that it's a severe illness, it can still be a very severe illness. So just keep that in mind.
Alright, the skin, it becomes less pliable, you tend to bruise either ear. Sweat glands don't respond as well, and you tend to get bed sores, which you can see on your right. And this is caused from pressure you put on the skin.
Alright, so special considerations, just things that you should be aware of, and just stuff to help you treat a geriatric patient. So it may be difficult to communicate with a geriatric patient, but you never want to assume that every geriatric patient you go to is going to be hard of hearing or incompetent. So you want to approach them with good communication skills, but every patient should be approached with good communication skills. So that's just something to keep in mind. Um, Patients can have a long and complicated medical history, which that just comes with being 65 plus years of age. And then here is an assessment uh, acronym, I guess, assessment acronym used to assess geriatric patients. So GEMS, it's called GEMS Diamond, and the G stands for geriatric patients, and it basically means that they may present atypically. So they may not have some signs and symptoms you expect to see with that illness, or they may have extra signs and symptoms uh, because of a lingering medical condition or something else. So environmental assessment, it will contain hints, especially if you're in the elderly patient's house. It may contain hints to what medications they took. Uh, may contain. Uh, Sorry, we had to pause the recording real quick. So, but the environment may contain hints as to what happened. For instance, medications. It may contain air tubes. Just it can give an insight into their history or what they took and why they're in the position they are now. Medical assessment. Again, they may have a complicated medical history, so make sure you obtain a very thorough medical history. So they may have less active social network, which can affect your ability to obtain information about the patient if the patient is unresponsive or not fully alert. Um, it can make hard to get an accurate history of the patient.
Okay, so polypharmacy refers to the use of multiple medications by one patient on a regular basis. This can have negative effects on the patient and can cause negative drug interactions. This can be very expensive to the patient. It makes it hard to know for certain which drugs was taken and when. This makes geriatric patients more susceptible to overdoses, and prescription drugs interacting with over-the-counter drugs is not always a good thing and could have negative effects and overload the patient.
Alright, trauma in elderly, it takes less force to injure a geriatric patient, and the blood has lost most of its ability to compensate for blood loss, heat loss, and food loss.
So falls with an elderly patient can be a bad thing because again osteoporosis. If they have osteoporosis, that puts them at a very high chance for fractures, or if the bones are just weaker. So something that may be a minor fall to us, may just hurt a little bit, be a broken bone for them. So you just want to keep that in mind. You also want to ask your question: Why did they fall? So, they could have fainted, they could have had cardiac rhythm problems or medical interactions.
All right, so advanced directives. This is when they have the do not resuscitate wristbands on them, and that kind of overrides your role, so you can't resuscitate them.
Okay, so special considerations with assessment, scene size up. You just want to look around, look for clues. Primary assessment, you have to place a higher importance on suctioning the patient's airway because they may have a decreased ability to maintain their own. You also want to look for dentures because if the patient has dentures, they can fall into their airway and obstruct the airway. Geriatric patients are also susceptible to shock, so you just want to keep that in mind. And then when you make a transport decision, you want to also remember that it takes less energy to cause a significant trauma to an elderly patient than it may to a 17-year-old. And then also secondary assessment and reassessment. Head injuries can be life-threatening just because of how the body changes. And if the patient has a hip fracture, you do not want to log roll them. Again, you do not want to log roll a patient with hip fracture. And again, it puts the geriatric patients are at a high risk for shock.